You. Now at 4:30, the U.S. is sticking with its 8-month timeline for those COVID-19 booster shots, at least for now. This comes as President Biden suggested that the administration was weighing whether to give those booster shots early as 5 months to fight the rising cases fueled by the Delta variant. So joining me to talk about this right now, the rollout of those COVID boosters, is Keith Grant, Senior System Director of Infection Prevention at Hartford HealthCare. Thanks for being here.
Thank you for having me.
So tell us, do you think that the timeline for those booster shots will be shortened eventually?
You know, I'm not too sure. I'm not too sure that that's going to happen. And I tell you why I say that is based on the data that we're having right now. Efficacy still holds very, very well. You know, in the state of Connecticut, we have about 380 individuals in the hospital, about 92 individuals in the ICU. And from the 92 individuals in the ICU, it's about 15 patients that are vaccinated. And, you know, we're keeping very close eye on those patients. So efficacy data still holds very well. And we're looking at Connecticut being one of the first big adopters of this vaccination to have a significant amount of the population vaccinated. So Connecticut does have a good platform from an epidemiologic perspective to look at this. So I think 8 months is a good timeline.
We've been getting a lot of this question. If someone gets the Pfizer vaccine, can they get a Moderna as their booster and vice versa?
No, so at this point in time, we're being very strict in sticking with the vaccine that you're initially given, primarily because when these trials are being done, they're focusing as such, and we want to be very, very safe with that as well.
And what about the Johnson & Johnson vaccine?
We're hoping to hear something soon. At this point in time, there's nothing out there that states whether or not Johnson & Johnson is going to be moving in that direction. But again, from an efficacy perspective, including Johnson & Johnson have been showing very good efficacy across the state, across the country, where preventing critical illnesses is concerned.
Now, do we think that this could become a yearly thing like the flu shots? Could there be a fourth booster shot in our picture?
Oh, God, I hope not, right? For a number of reasons. So what we're believing and we're really hoping for is that we will get to a point where we don't have a pandemic type that we're managing, right? So let's say we get to a point where the SARS-CoV-2 becomes one of the respiratory diseases that we manage every year, like we do for RSV and we do for other respiratory diseases. And at this point in time, however, especially with the Delta variant being over 1,000 times more contagious than our previous Alpha, we're hoping to make quicker management, especially with our colleagues or patients that are over 65. Have we seen a significant increase in that number for breakthrough infections and for our individuals that are immunocompromised as well? But I'm hoping that it's not every year that we're doing this.
I think a lot of people are hoping the same. Before we let you go, it's back to school. A lot of parents worried about their kids. Any updates on when shots will be available for the younger children?
You know, the data that we have now, the information that we have now, it's continued to say within the next few weeks. But I will tell you that the studies are ongoing, the trials are ongoing. They seem to be very effective, very safe so far in the pre-reads that we've had the ability or the privilege of seeing. What I can say is if you look at how Connecticut as a state managed our students the last semester, if you look at any outbreaks or any spread within schools, exceptionally limited. So I will say with parents, even without vaccines being available in certain age group, continue to do exactly what you were doing before, and we should be fine.
All right, Dr. Keith Grant from Hartford HealthCare, thank you so much for your time. A lot of good information there.
Absolutely. Have a good day.